Roughly 30 million Americans are getting some type of unemployment benefit across the country, largely thanks to coronavirus-forced business closures. But some groups have been faring a lot worse than others, with Black and Hispanic or Latino Americans significantly more likely to be out of work than their white neighbors, according to government data, although many economists believe unemployment rates are even higher than what the official numbers show. And while the expansion of unemployment benefits, along with those federal relief checks, has led to a slight and temporary decrease in the national poverty rate, there are big concerns about what happens if and when that money runs out, as Republicans in Congress have been pushing back against the Democratic proposal for another stimulus package, questioning whether more payments are needed at all. I'm joined now by two economists, Esther Duflo and Abhijit Banerjee, who together won the Nobel Prize last year for their experimental approach to alleviating global poverty. They're also the authors of the book Good Economics for Hard Times, co-founders of MIT's Abdul Latif Jameel Poverty Action Lab, and as it happens, husband and wife. Congratulations belatedly to the two of you, and good to meet you both. Thanks so much for being here.
Thank you.
Esther, in a piece the two of you wrote in The Economist in May, you compare a pandemic to bombings during a war and suggest that the fix might be guided by what one does after a war. What specifically are the two of you suggesting?
I think what's very specific about the COVID-induced crisis compared to, say, the 2008 crisis is that it has come from the outside. It was induced by this need to close off the economy in response to the virus, very much like in a war where it really comes from outside, as opposed to a crisis like the 2008 crisis, which was also a symptom of deep dysfunctionments. And what we've seen in wars is that when the condition improves, when the war goes away, in many cases, economies pick up very quickly. And so we pointed out that it could be the case in this case as well.
But Abhijit, one of the things you two warn about in that piece, if I may, is you talk about the worry about when the public health crisis and an economic collapse combine, there's a potential loss of legitimacy, particularly in developing nations. And you listed three criteria to try to avoid. Avert a collapse of a healthcare system, support vulnerable people, test enough people. I'm sure you've heard other people say this. While I assume you were talking about developing nations, at least a couple of those failures exist right here in the richest nation in the world. So what's the consequence when we fail this test here in the United States?
Well, I think that the fact that there is already a crisis of confidence in the state. I think if you look at who would support in a poll welfare payments, is often the poor who are against it because they feel that somehow the state is not reliable, that it won't do it. And if it is, and I think what you need at this point is confidence that the state can navigate your way out of it, that they will, if necessary, as the chairman of the Fed has said, will do whatever it takes to make it work. But that statement may not have a lot of credibility with a lot of people who've been through many things, who see the president saying one thing and reversing itself. The degree of messaging, the way the healthcare sort of management has been handled, all of those things might undermine confidence. And confidence is critical because we want people to just feel that, okay, fine, I can now start spending money because the future will be okay.
But what happens not in a developing nation, but in a wealthy nation like ours, when we don't restore that confidence, when it doesn't exist, when we aren't testing enough people, if there's not a second relief package, we will not have satisfied that goal either. What happens here?
I think we are in a very dangerous moment. And people have said that vis-à-vis the epidemic, but I think we are also in a very dangerous moment for society itself and for the general compact and cohesion of the nation and society, precisely because it was a make or break moment for the government. In a pandemic, we need government. If the government had succeeded on the health front and on the economic front, it would have restored a part of its legitimacy. If it doesn't, and it seems to be failing on both, and then we are, going further into the precipice. And I think it will go further than this administration, unfortunately.
I know you both got attention when you suggested that a universal basic income in India was part of the solution there. Are you supporters, Abhijit, starting with you, of universal basic income around the world or in targeted settings?
I would say that in our book, we make the case that for a country like the US, is probably not the obvious solution to the stress we have. I think we know all too well who are the people who have suffered, who have paid for our general kind of sense of prosperity, which is not shared with many people. So I do think that we need to rectify a bunch of past unfairnesses that have accumulated over time. So I think in the US, if you really want to reclaim legitimacy of the state, you need to recognize the pain that people in a lot of, in Ohio have paid, and they have not paid in Massachusetts, or at least in eastern Massachusetts, they have not paid. So I think those things are important, and I think if we want to reconstruct the US as a more together nation, I do think we need to attend those things. But I think targeting, at least based on some particular forms of, I think, egregious forms of unfairness, really needs to be taken seriously.
It seemed to me when I knew you were coming on and I read the report that I mentioned before, suggesting that unlike what most of us thought, that the poverty rate would go up, that it is not basically stabilized, if not gone down a little, based upon the payments made by the federal government. Doesn't that make the case for the value of a universal basic income, Esther?
Well, the payment we have received were not universal. They were, even the payments that came through the stimulus payments were under a given income. And of course, a lot of people were supported by unemployment benefits, which are not universal, they are targeted. And that makes perfect sense. You want to use a limited budget to the people who need it the most, which in this country is possible because we have the information. But the two of us don't need any part in the universal basic income, and there is enough data in this country to target it towards those who need the most. So if the decision had been made to give everybody exactly the same, which is the idea of a universal basic income, then much less would have been given, and I think the effect on poverty would have been felt less effectively.
Abhijit, I just have a couple of seconds. I know you're an economist, and I know you're not Nostradamus, but is it possible out of this darkness that we may come to see some light, that some policies that the two of you have been advancing that may have seemed radical in normal times will be acceptable here and around the world in these darker times?
I'll give you the example that I keep mentioning, which is education. I'm so impressed by how quickly we got used to education online. And that the US is the world's greatest source of good education. And we could become a much bigger source of education for the whole world. I think the lectures at MIT that 30 people listen to could be listened to by 3,000, 30,000, 3 million people. That's one place where I imagine good could come out of this.
Esther Duflo, Abhijit Banerjee, congratulations again, and thanks so much for your time. I appreciate it.
Thank you.